St. Kitts and Nevis has recorded a new case of COVID-19. Chief Medical Officer Dr. Hazel Laws disclosed at a special briefing of the National Emergency Operations Centre, NEOC, on Saturday that a new case arrived in the Federation on a charter flight on November 8th. The individual has been in quarantine since arriving on island and is now in isolation.
Last evening, the Ministry of Health received the positive laboratory report, positive COVID-19 laboratory report of our 20th case of COVID-19. So as of today, St. Kitts and Nevis now has a total of 20 confirmed cases of COVID-19, 14 St. Kitts and 6 Nevis. This additional case of COVID-19 is an imported case. The individual would have arrived in the Federation on November the 8th, 2020, and has been in quarantine since arrival. We want to assure the general public that the protocols have been followed along the corridor of containment between the airport and the arrival of the individual, at the accommodation site. And I want to add that supplemental or refresher training session was conducted at the accommodation site this morning. And so we met with all majority of the staff members at that location, and we underscored all the protocols that are to be followed as they host international travelers.
This takes the total number of confirmed cases to 20, 14 in St. Kitts and 6 on Nevis. All previous 19 cases have since recovered. St. Kitts and Nevis reopened its borders to regional and international travelers on October 31st. All travelers must submit a negative PCR test 3 days prior to their travel date before being allowed to travel to the Federation. They are then tested on arrival and placed in quarantine. Andre Huey, SKN Newsline.